Hey, a patient a new admit came in. I just put her in bed one. Name's Margaret Smith. She came in with her daughter. She was found down in her home on the kitchen floor.
Okay. All right, let's go ahead and see. Knock, knock. Hello, Miss Smith. Hi. Hi. I'm Nina. I'm going to be your nurse. How are you doing?
What?
How are you doing today?
She's having a hard time understanding. I found her just passed out, laying on the floor. I don't know what's wrong with her.
Okay. Does your mom have any medical conditions, any chronic conditions?
I know she has a problem with her heart, but I don't really know. I mean, she usually takes care of her own medical issues. She's pretty on top of it, so this is really not normal.
What? Okay. If you can just keep your eyes open for me. Are you able to keep your eyes open for me?
What?
Here, I'm going to put my hands in your hands. Can you try to grasp onto my hands for me? No? Can you squeeze hard?
She's been like this since I found her.
What? So she feels kind of sweaty. Very confused. Have you eaten today?
Yeah.
Yeah? Have you taken any medication today?
I took my meds.
You took medication today?
Yeah.
Did you take...
What's today?
Today's Thursday?
Yeah.
I'm going to listen to your heart. So what medication did you take today?
Oh,
What?
Mom, I can call. I'll call the
pills.
pharmacy and see. I don't know all the stuff that she takes,
It's
but I'll call
my
and
pills. It's
Your
my
pills?
I'll call and find out.
I know my white one.
Do you remember, are you able to remember what time about you took them? Like in the morning after you woke up, or before you eat breakfast, or after breakfast?
It's when I normally take them.
When you normally take them? Okay.
I just start feeling really weird, and then I'm here. How did I get here?
Okay. Well, you were found on the floor in your kitchen. Your daughter found you, and then she called the ambulance, and then you're at the emergency department. Jess, I think maybe we should take a blood sugar.
That's the glucometer.
I talked to
Pretend
her.
that's the glucometer.
I
Okay.
talked to her, the pharmacist, and he said she takes something called diltiazem.
Okay.
And aspirin. I know she takes aspirin every day. And then
Okay.
he said something called metformin
Okay.
and glyburide.
Okay.
Those are the things that he said she takes.
Do any of those medicines sound familiar, what you took this morning?
Yeah.
Okay.
Did you take all those, Mom?
I took my normal one.
Okay.
Okay.
My normal ones. I took my meds, and then I felt weird, and I went to sit down, and I don't know. Maybe I got that thing from Timmy.
Oh, Timmy was sick. Oh, she watched my son Timmy, and he had some kind of GI bug. So I don't know if maybe that's what she has.
Have you had any nausea or vomiting?
I was a little nauseous, but I went to sit down, and now I'm here.
Okay. Well, your blood sugar is 45, which that's
Oh.
lower than normal. That's lower than normal. So we're gonna Jess, how about we get started? Yeah, the D50. So we need to get your some glucose in your mom
Okay.
to get her blood sugar back to normal range.
Do you think that's why she's acting like this?
It would seem to be the case. So
I'm gonna get the D50.
okay, with that low blood sugar number, that definitely would explain the confusion and feeling, sweaty.
Okay.
Not having the strength or coordination to, grab my hands. So after Jess gives her that D50, which is a infusion of concentrated glucose, then your mom should start feeling better pretty quickly here.
Okay.
And we'll recheck the blood glucose.
Okay. Okay. All right, so we're gonna check your blood sugar again.
Okay.
How are you feeling now?
Oh, I'm good. How are you?
Well, I'm well, thank you. My name's Nina. I'm a nurse here in the emergency department. You're at the hospital.
Mom, you're at the
When
hospital.
did I get here?
I found you this morning. You were on your floor. Don't you remember?
No. Okay.
You weren't making any sense. I brought you to the hospital.
I'm gonna take your blood sugar. I took your blood sugar earlier and it was 45.
Oh.
So we gave you an infusion of some glucose in your IV.
Okay.
That was a little while ago, and so it appears that you're more
Did you take your
alert.
medicine this morning, Mom?
Yeah, I did, but I felt weird. I felt weird, and I went to sit down, and
Well,
how
you're,
long have I been here?
You've been here for about an hour or so since I called the ambulance.
so your blood sugar is 95 now.
Oh,
So
that's good.
back within normal range. So that's good. So tell me, so you take glyburide, and was it also metformin?
Yeah, that's
Yes.
what the pharmacist said.
So you told me earlier, but you were confused when you came in, that you took those medicines this morning?
Yeah.
Did you take them before you ate?
I take them when I normally do, and have my breakfast, and
You had breakfast?
yeah. And
Okay.
it was just after. It was just I felt really weird.
Was there a long, was your breakfast delayed? Did you take your medicine and then did some time go by before you finally got around to eating?
Yeah, I burnt my toast the first time, so I had to make more.
Okay.
Did you eat your toast? It didn't look like when I came, it didn't look like you had touched much of your, it was still sitting on the plate there.
Don't think I did.
So you might have had a hypoglycemic reaction from having taken your medicines, but on an empty stomach because you didn't eat in time, and then your blood sugar just dropped like a rock. So Jess, we just brought someone in, Miss Smith. She's 68 years old. She's had some mental status changes, weakness, and her daughter found her this morning at her house on the floor. And she called the squad.
Alright, let's go in and take a look.
Okay.
Hi, Miss Smith. How are you doing today? My name's Jessica. I'm going to be your nurse. And this is Nina.
Hi, I'm Nina. I'm the charge nurse.
What brings you in today? Sounds like we found you on the floor and you're in
She's
the
a neat-
emergency department.
She needs to eat more.
Okay. I'm gonna check your eyes. Can you tell me your name?
She's a diabetic. She just doesn't eat enough. She needs to eat more.
Margaret.
Alright, we're gonna check your blood sugar. Also take a listen. Listen to your lungs, make sure everything's okay in your heart and everything.
What's happening?
You just gotta eat more. You don't eat enough. I told you about that. Now we're here.
When did I get here?
I don't know. It's been a while.
We're gonna check your blood sugar.
Who is she?
Oh, that's one of your nurses.
I'm your nurse, Jessica. Alright.
I found you down this morning, Mom. You gotta eat more. You gotta eat.
I ate.
Thank you this morning. Well, it looks like your blood sugar's fine. It's 95 right now, so. Alright. Do you think so you fell down on the floor? I'm thinking maybe you hit your head on the floor, so we're gonna order a stat CT.
Would you like for me to draw some labs?
Yes.
Okay.
And also we'll draw some labs just to check your blood levels. We wanna make sure there's no head injury.
You're sure it's
or that
not
you're
her
not bleeding.
diabetes? Normally that's why we're here, she's just not eating enough.
We checked her blood sugar and it's in the normal range.
Oh.
So it's not the blood sugar. So we're
Okay.
gonna draw some blood, send it off to the lab and see if there's anything, if your electrolytes are out of balance. So we're gonna take a look at your monitor here. It looks like your heart rhythm, it's in AFib and it's about 78 beats per minute. It's a normal heart rate, but we wanna, it looks like your heart's having a little trouble pumping right now, so.
Do you think
we're
her
gonna-
meds are doing this? She's on like glucophage and some cart thing and
Well,
Coumadin
I
and.
have the lab report back. Her INR is 1.3, and then her head CT indicated no bleed.
Okay. Alright, well then that means you're not having a bleed in your head right now. So we're gonna see if maybe there's a blockage. That's probably the other indication, so. We're gonna see if you can get some TPA, which would be to break up a clot in one of the arteries in your brain. So I just have to ask you a few questions to make sure that you can have the TPA drug. So have you had any recent surgery?
I don't have one.
No.
Is
Is she having a stroke?
That is what it's indicating right now, so.
Oh.
What does that mean?
Oh.
So that means that there is a blockage in a vessel in your brain, so that's probably why you went unconscious. Since your blood glucose is fine and there is no, it's not a hemorrhagic stroke because you're not bleeding in your brain, at least that's not what the CT shows. So we just want to ask you a few other questions. Have you been in a car accident recently?
No.
Okay. So, and it looks like your INR is in the right range, it's at 1.3, so we can give you the drug.
Okay.
So I'm gonna go get the order for the TPA.
Okay. Well, thank you.
Thank you. Do you have any other questions?
No. I thought it was her diabetes again.
Hi, Allie. We have a new patient that we just brought in. She is Mrs. Smith. She's 68 years old, and she was found by her daughter confused on the kitchen floor. And she's had some mental status changes.
Okay. So let's go see her. Hi, Mrs. Smith. I'm Allison. I'm your nurse today. How are you doing? Hi there. Is she normally like this?
No, I've never seen her like this. She was on the kitchen floor this morning.
Can you squeeze my hands for me? Mrs. Smith?
She hasn't really been able to tell me what happened at all.
You found her on the floor this morning?
Yeah, she's a diabetic, so usually she eats her breakfast, she takes her meds.
Mrs. Smith, can you look at me? Hi there. Hi there. Did you take your meds this morning?
She's also on a blood thinner, she's on Coumadin. She had some aspirin in her
Okay.
cabinet. I'm not sure if she took any, but.
Okay. All right. Well, let's go ahead and get some labs drawn. Let's get her down for a stat CT. She seems pretty out of it. Can you squeeze your hand for me, Mrs. Smith? Okay. Yeah. Let's go ahead and let's get a glucose on her, and we'll get some labs going. And we'll see what's going on. Mrs. Smith, did you take your meds this morning? Do you remember? Her glucose seems to be okay. Yeah, let's go ahead and let's get some labs drawn. And let's see what's
I'll
let's
send
see
these
what's
off
going
to
on.
the lab.
Okay.
Hang in there, Grandma.
All right. We'll be right back, okay? We got labs back.
We've got her INRs at 7.3.
Oh, okay. Well, we need to send you down and have some further testing because your blood pressure is really high right now. Okay? Okay. According to her head CT, there might be a bleed going on, so we're gonna call neuro. They're gonna come in and do a consult and do an evaluation on her. She might be having what's called a hemorrhagic stroke, which is a bleed in her brain. So we need to have neuro come up here and take a peek at her, okay?
Is that really serious?
It can be. We just got to see what neuro has to say, okay? Mrs. Smith? Hi there. Are you with us? Can you squeeze my hands at all? No? Okay, we're going to get neuro up here and we're going to see what they want to do, okay?
Okay.
All right. Thank you.